those glasses and that hat, she's definitely the winner.
I feel like you should be presenting tonight, Glenda.
Just turn down the brightness.
Yeah, lovely. Well, welcome everyone tonight to our Zoom meeting. It's Monday, the 20th of April, and we're joined now by 24 people. So thank you for coming online tonight to the District 9800 Zoom meeting. We've got a few first timers, so that's excellent. We've also got some very important guests with us, including our guest speaker, Lien, who I'll introduce properly in a minute. But I'd just like now to pass over to past District Governor Keith Ryle, who'll introduce some of our other special guests tonight. Thanks, Keith.
Thanks, Grant. Well, in alphabetical order, we have Catherine Oborn, also called Kat Oborn, and then Dr. Elena Zoukelis. Last Wednesday evening, the District 9800 Global Grant Scholarship Selection Committee met, and the two successful candidates were Kat and Elena. Kat is planning to go to Syracuse University in New York State to do a master in, I hope I get this right, Kat, policy management. And Elena is going to Oxford. She had an offer from Cambridge as well, and she's doing a master in neuroscience, and that she hopes to pursue her interest in dementia research along with her medical career. Kat's passion is about helping disadvantaged children just simply get a better education. So it's a nice blend. We've got Kat focusing at the younger end of the spectrum, and we've got Elena doing on research that will impact typically the older group of the spectrum. So all we need now is for Rotary International to approve our applications, and then hopefully they'll be able to head off sometime later this year to Syracuse in New York State and Oxford just out of London. So, and also we have as a guest speaker, Lien. That's very appropriate because Lien was our very first Global Grant Scholar some 7 years ago. So it's a real great example of what Rotary does in the field of postgraduate education. So very special welcome to Elena and Kat, and of course also to Lien. So I'll stop there.
All right, thanks, Keith. Fantastic. Thanks very much. Do either Elena or Kat want to make any comment? No? No, doesn't look like it. If you want to, just unmute and I'll allow you a minute.
I'll just say thank you very much. It's a real honour to have been selected. I'm very grateful, so thank you.
No, that's fine. And congratulations to you both. And you both did a wonderful job last week in your interview. So congratulations and well done. All right, I'll keep moving on. So joining us tonight, as Keith mentioned, is Lien Trin. Now, Lien is an optometrist and graduated in 2004. That's a long time ago, Lien, now when you think back like that. Lien travelled to Sri Lanka, Vietnam, Papua New Guinea, trained doctors and nurses in eye care and improve eyesight and prevent avoidable blindness. And then she's also worked in Outback Australia in the past as well, but at times felt ill-equipped to manage some of the issues that she saw and wanted to do something to help. She, as Keith mentioned, she was our inaugural District 9800 Global Scholar and received a grant from the Rotary Foundation to study a Masters in Public Health at the London School of Hygiene and Tropical Medicine. She spent a year in intense study looking at the social determinants of health and how people work in the community development to create change in a very impactful way. Lien's been supporting Rotary ever since, especially with, as Keith mentioned, the selection of global scholars, also on the Trachoma project, and she's the first incoming president of the soon-to-form Northside Rotary Club. So fantastic to have you here tonight, Lien. And if you'd like to unmute and start your presentation, that'd be appreciated. And thanks very much for joining us.
Absolute pleasure. Thanks for having me tonight, Grant. Can everyone hear me okay? Because I know my mic sometimes plays up. Fantastic. Okay, I'll just start sharing the screen to the presentation. So I think, Grant, you've given a really comprehensive overview of my my career and the work that I have done through Rotary and the work that I intend to do with Rotary. And I actually, tonight I felt I probably should focus on one of the core components that is currently happening, which is the End Trachoma by 2020 project. So I think I will concentrate on that. It's really wonderful to see so many familiar faces, and congratulations again to Kat and Alina. You know, you guys gave such an outstanding interview last week, and I really wish you guys all the best in your studies and your future careers. Now, I'll start off by acknowledging the traditional owners. I do that at every important meeting that I go to, and I do it because I want to acknowledge the history of our country here in Australia. I think that's really important, and it's a really important step towards reconciliation in Australia as well, and living in harmony in the diversity that we have, the beautiful diversity that we have in Australia. So I would like to pay my respects to elders past, present and continuing. And where I am in Melbourne is on Wurundjeri country. So people from the Kulin Nation, I pay my respects to. The End Trachoma by 2020 project has been running now since 2016. And this is actually the project update PowerPoint. So I'm sort of presuming that some of you, or all of you, are somewhat aware of the project, but I will go over the basics of trachoma in Australia and where we currently are in our project and where we have been throughout the project. Now, trachoma is a bacterial eye infection, and it's a highly infectious disease. It's highly contagious, and it's caused by the bacteria Chlamydia trachomatis. And what happens is it will give the recipient a sort of conjunctivitis, and this conjunctivitis will actually be managed quite well by the host's immune system. But the issue with trachoma is that it is recurrent. It's highly infectious, and it can continue to infect and reinfect and continue to reinfect if the conditions are not controlled. And this is what we're seeing in Australia, uncontrolled conditions which allow continuous reinfection. And you need about 250 to 300 of these infections to get to this point here, which is the picture that you see on your screen, which is corneal opacification. So that whole clear part of the front part of the eye, which should be clear, is now pretty cloudy and scarred. And that's because that continuous infection and reinfection causes scarring of that the inner conjunctiva of the eyelids. And that sort of turns the eyelids in. When you get an inturning of the eyelids, you have the eyelashes scraping against the eye. And if you've ever had one eyelash sticking into your eye, you'll know how extremely uncomfortable that is. If you can now imagine having all of your eyelashes churning into the eye, it's a really painful condition to be suffering from. And the blindness is irreversible. So this is normal vision. You should be able to see quite clearly. You might need glasses, that's fine. You should be able to see quite clearly. But someone with trachoma or end-stage trachoma will basically have complete blindness. Now, the World Health Organization has what we call a SAFE strategy. It's an integrated strategy to try to eliminate trachoma globally. And that safe strategy involves a treatment arm, which is surgery. And the surgery is to meet that acute need of repositioning those eyelashes so that they don't lead to scarring of the cornea. There's antibiotics, which happens in Australia where mass doses of antibiotics are distributed to communities to treat the infection and also to reduce the risk of infection among individuals. So because it's a bacterial infection, the antibiotics will support the treatment of the infection. Now there's the F and the E part of the strategy are the preventative arms of the strategy, and the F stands for facial cleanliness. So we want to ensure that the face is clean, that there's none of that mucus and pus on the face, which will support the transmission of the disease. And we want to ensure that the environment in which the people who are affected by trachoma, that environment that they live in, has some basic access to water and sanitation, and that the capability to practice facial cleanliness. Now, here's a map from the World Health Organization website showing you where trachoma is as a public health problem across the world, and you can see that trachoma affects 37 countries in Africa, countries in South America, the Middle East, Asia, and you can see that Australia is quite an outlier there, being a high income country in the in this sort of environment of trachoma as a public health problem. So trachoma mainly affects regions where there is intense poverty and a lack of access to hygiene and sanitation. Australia has been reporting on trachoma rates for some time. This is a graph from one of the reports sort of demonstrating the prevalence trends, and I will preface this graph by saying that no data is ever perfect or complete, and you know, the data that we had back in 2007, 2008 is definitely not going to be as accurate as the data that we have now, simply because there wasn't actually committed funding prior to 2008 into looking at the data for trachoma. For example, back in 2008, there were 235 communities that were deemed at risk of having active trachoma or high rates of trachoma. But there was only half of those communities that were actually actively screened and treated. Whereas now in 2018, and I say now, unfortunately that is our now, that's all the data that we have, we've got 120 communities that are now deemed at risk. So the number of communities that are deemed at risk has dropped off significantly, which is fantastic. And importantly, 91% of those communities have been screened and treated. So our validity of the results that we're getting is much higher than it was back in 2008. I'll just, I guess, point your eyes to the orange line, which is the national trend. And you can see back in 2008, when the National Eye Health Survey data came out, that we did have quite high rates of trachoma. Almost 1 in 5 children on average in these at-risk communities had trachoma when they were screened. And that's an average. So, you know, some communities, we had almost 100% rates of active trachoma. And then some communities didn't have active trachoma, which is fantastic, but, you know, quite high rates. In 2008, there was committed federal funding, and that led to a concerted response across all the jurisdictions that were involved. So South Australia, Western Australia, and the Northern Territory. And that's when there was a real effort to screen and treat the communities through that mass antibiotic distribution program as required. And that's what's led to that huge reduction in rates of trachoma that we can see over the years between 2008 and 2012. And then we noticed a plateauing of that national average, hovering just below 5%. And 5%, the 5% is the magic number actually. 5%, below 5% means that you've eliminated trachoma. So when we talk about elimination, it's different to eradication. Eradication means that it's completely gone. Elimination means that the rates have come down low enough in the community that they can control it themselves. Australia, even though it looks like we've eliminated it, we haven't, because one of the criteria to elimination is that we have to cease mass antibiotic distribution. And that's not a point that we are at the moment, because we're still noticing that in some communities, for example, last year that were screened, there were still quite high hyperendemic even rates of trachoma, hyperendemic being more than 20% of people screened having trachoma. I'll just talk to the trend since we've been on the project, so that you guys can see what it's looked like while we've been working with all the other stakeholders involved in trachoma elimination. So the three main jurisdictions that are affected are Western Australia, the Northern Territory and South Australia. And you can see in the Northern Territory, the darkest brown region, between 10 and 20% of prevalence rates is in that Central Australia region. And that's a trend that continues actually over the following 3 years. South Australia has between 5 and 10% mostly across a lot of their regions. And then you sort of, it sort of looks like Western Australia is on a pretty good trajectory. And in fact, in 2016, Western Australia did think they were on a great trajectory and didn't really ask us for support. But we were receiving requests of support from the Northern Territory and South Australia. In 2017, we're seeing a marked reduction in South Australia, which is fabulous. In the Northern Territory, the prevalence rates are hovering around the same. Central Australia region still quite high. The Katherine region now has sort of the Barkly region's problem, but it's sort of all much of a muchness. And then in Western Australia, we're starting to see a darkening of those regions in the Midwest and the goldfields. So we're starting to see a resurgence of trachoma for whatever reason. And then you can see here in the latest data, which is 2018, that South Australia is still on a really good trajectory. It's clear that the Northern Territory still continues to need a lot of support, and Western Australia is still hovering around about where they were. But you can see from the average percentages that we are hovering below the that magic number of 5%. I also talk about the data that we have as not ideal, because it's data back from 2018, and this is an issue that we've had on the project in terms of showing the effectiveness of some of our interventions. I mean, we would love to have that tracking that COVID-19 currently has, where you can see the exact number of cases every day, and you can track 2 weeks from when you initiated an intervention to what happened now. But trachoma is not a notifiable illness, so we don't have that luxury. Now, I want to talk to you about the projects that we've delivered between 2017 and 2019, the last few years. 2016 and 2017 were years of real intensive investigation. And one of the skills actually that I am completely indebted to Rotary and the London School of Hygiene and Tropical Medicine for is from my studies of medical anthropology, because it really taught me about how much you need to understand communities before you can, suggest interventions. And so all of these projects that we have done is all about partnering with stakeholders on the ground. None of the projects have really been about what we feel is best to be done. It's all about talking actively to Aboriginal organisations, Aboriginal people from the community about what they are needing for their community. And I think that's the strength of Rotary as well. Rotary has a real bottom-up approach in terms of working with individual communities. So in 2017, we released this flyer showing some of the projects that we had released into the communities. And some of them were pilots, The water trailer project was a pilot that was a project completed in collaboration with the Rotary Club of Melbourne and the Monash Industry Team Initiative. We distributed mirrors as a pilot initially in the APY lands through Nanapa Health Council, and they were such a hit. And actually, I'll talk a little bit about the mirrors later, but that was a very, very successful pilot that was run. We ran a face washer pilot, and we ran a pilot with washing machines, portable washing machines and spa taps. And these were projects which were driven by what had been at the time an Australian Trachoma Alliance. So the Australian Trachoma Alliance was basically an alliance of organisations working in the field of trachoma, in the field of health, looking at different ways to support community involvement in, self-determination, eliminate the elimination of trachoma. And so we worked very closely with the Gwen Troutman Weir at the time, who was an Aboriginal woman who was the program implementation manager for the Australian Trachoma Alliance. And a lot of her ideas were the projects that we supported her to pilot in community. In 2018, we formed a really strong relationship with the Environmental Health Trachoma Project in Western Australia. I think 2018, after we came on board in 2017 and spoke to the fact that we didn't think that enough was being done in prevention for trachoma, and made a clear statement about what our intentions for Rotary were going to be in this space. We certainly didn't want to be duplicating current efforts in the space, but there was a clear need that more should be done in prevention, in education, and in improving access to hygiene and sanitation. And because of that, and I think that's something that I'm really proud of in the project, is that through that advocacy, Western Australia also decided that they needed to include an environmental health trachoma project arm. And they allocated funding, some funding towards that, towards environmental health. And we were able to support the people working on projects in environmental health in Western Australia in a number of ways. They ran a really fantastic safe bathrooms project, which involved them going around to communities, ensuring that wash areas were safe and accessible. And they put up, as you can see, some of the mirrors that we funded through our project. That man below is putting a mirror in, importantly, at child height. And then in 2019, we really revved up into some clear projects that will be of benefit to the community. So I'll actually discuss a few of the really successful projects over the next few slides, but I'm actually quite unapologetic about some of the projects that haven't worked, some of the pilots that haven't worked, because I think we've needed to go through those processes and also, importantly, work with the community and show them that we want to support them, even if the idea doesn't work. And so I'll certainly highlight a couple of projects that didn't go to plan. One project, as I mentioned before, was the portable wash machines. Gwen thought that these wash machines would be fantastic because they didn't require power, and power is something that isn't necessarily reliable when you're in the remote context. It required very little water, and it allowed people to wash their clothes, wash their things. We provided a whole bunch of these portable wash machines to a number of different communities. Leslie Martin there painted that one. She was also one of the program implementation managers at the Australian Trachoma Alliance and is currently working at Indigenous Eye Health. And we, importantly, after the pilot, reassessed how these machines were going, and we found that because the lids were removable, kids were playing frisbee with them and then losing them. And so we looked at the supply chain, because they were incredibly affordable machines. We could get them for, I think, about $60 or $70 for a machine. So we thought that they were cost effective, but in terms of looking at the supply chain for the supply of parts and repair and maintenance, it was just going to be a real problem. Because there weren't spare parts for these machines, and you'd need to continually replace the machines. So we felt like we were adding more to landfill than actually solving a community problem. Spa-taps were also piloted, and some of you might have seen this device. It's used in humanitarian crises, and it's a way to provide access to water so that you can wash your hands. And all it needs is a water bottle of any size that you attach to this silicone device, and then you hang it up on a tree. It's used, quite a bit over in countries like Africa, where hand washing, isn't easily accessible, and water needs to be collected from a well, which could be kilometres away. In the Australian context, it hasn't worked so well, partly because and one of the clear things about our project is that we don't replace government responsibility. And in Australia, access to water should be a clear, issue that the government needs to ensure that every home has good access to water. It may not always be the case, but these spa taps, for that reason, and also being something that can be thrown around, easily lost, didn't really quite gain traction in the communities. But it was suggested by one of our Rotarian district champions, actually, Tony Freeman. So there are a couple of our project challenges, and I guess, like I say, I'm unapologetic about the fact that we've tried things through the community, and they haven't been as successful, and we've had to cease those projects. But like I say, the most important part is that we've had the community on board the whole time, and that's what's built our trust within these communities. Now in Santa Teresa, which is about 2 hours south of Alice Springs on a dirt road, we held a Rotary barbecue early last year, and also installed a community laundry. And that was fantastic. We had a whole bunch of different stakeholders in health from the Northern Territory Government, Environmental Health, the Trachoma teams from the Centre for Disease Control come out and talk to the kids who came along. And we were able to provide them with a community laundry. And we partnered with an organisation within Santa Teresa for that particular project. It was a real great partnership, because this particular organisation had a whole heap of other fantastic initiatives going on in the community as well. They ran the community store, they'd set up a community coffee van. That laundry there is situated right next to the community hairdressing salon, which had just been opened up as well, and they were busy training people from the community and giving them a sense of pride. So we were really happy to be partnering with them, and knowing that that community laundry wouldn't just be delivered and then unused and potentially left to disrepair. We knew that project was going to work really well, so that was funded. Portable water tanks has been a huge hit, and actually to this day, while we're working on COVID-19, our project has been approached to see whether we could help provide any more of these portable water tanks to community. So I'm thinking about these portable water tanks and why they would be useful. We have to think about the way of life of Aboriginal people living in remote communities. They are excellent for providing hygiene and sanitation and even drinking water to meetings like sorry camps, funeral setups, which are on country, are not necessarily in the community setting where there is access to bathrooms. Sorry camp, men's business, women's business, all of these different events which we might necessarily be privy to are located on country. And we hear a lot of anecdotal evidence from health clinics about how much infectious disease presents to the clinic every time these events happen. And it's simply because there is a lack of access to hygiene and sanitation. So we partnered with Nanapa Health Council with a mob called RASAC, the Regional Anangu Services Aboriginal Corporation, who are an Aboriginal group that provide upkeep services to communities in the APY lands. South Australia Health, Prime Minister and Cabinet, and Ross Engineering up in Alice Springs. Neil Ross is a Rotarian from one of the Alice Springs clubs, and we enlisted him to help us create the most appropriate vehicle and device that would be supportive of these events and provide what was needed out there. And we came up with this fantastic 1,000 litre portable water tank with sinks, with Rotary stickers all over it. It was fantastic. And so there's been a lot of gratitude because these trailers are now out there. Some of them, there were only 3 of them, but more are being asked for. One of them is currently being stationed outside one of the community stores in the APY land so that people have access to a hand washing station before they enter the community store, in light again of COVID-19. Now, as I mentioned before, the Mirror project is probably one of our most successful projects to date. We've delivered over 7,000 mirrors to Western Australia, South Australia and the Northern Territory. And in particular, the partners that we found in Western Australia through the environmental health teams there have been amazing. Western Australia have a clear safe bathrooms program where they go into community, they support community homes, they ensure that bathrooms are functional, that taps are working, that showers are working, you know, and it's hard to think of, you know, why these things are happening, why repairs are so often required. We hear a lot of criticisms of Aboriginal people living on community, like, you know, the cost of maintenance of their homes is so high. They're on these leased properties. Why do things keep breaking down? But if you actually live out in that environment for a week or two, you completely understand this hard water that's coming through these taps and corroding the pipelines and you know, totally blocking up the shower heads. You have a very superficial understanding of some of these issues that are faced by these remote communities. So this Safe Bathrooms program is really fantastic because it really brings it to light. It collects the data, and as we know, data is perfect for advocacy. The beauty of this Mirror project is that we're actually not telling anyone to go and clean themselves. Nobody likes to hear advice, particularly when that advice is coming from somebody who's not like you. And really nobody, you know, really likes to be constantly bombarded by education, which is what is happening out there. There's so many messages out there of all these diseases that people are suffering: kidney failure, rheumatic heart disease, scabies, you know, wash your hands, clean your face, have your shower every day, brush your teeth. The list goes on and on. So there's a real bombardment of messages, and this really, really simple tool that we take for granted in our everyday lives, a mirror, is such a great tool of self-determination and empowerment, because it instills in people a sense of pride. That's what a mirror does for you and I. We have a good look in it every day just to make sure we're presentable before we go out. And when we trialled these mirrors in the APY lands, I think Steffi Raynow from Nanapa Health just sent out 20 to begin with. He paid for it off his own back because he wanted to see himself whether that would be of any use. They were sort of thinking, when we had suggested it on one of our project scoping tours, they sort of had an idea that it might be useful, but they didn't realise how much of a demand there would be. And there was so much of a demand, they started seeing mirrors go missing. and being put in other places, because they were, you know, such a hot product that was not in anyone's homes. And, you know, over the years, stories have emerged from different people who've sort of talked to me about how they'd be at a pub and the women's bathroom would just be filled with people plucking their eyebrows or using the mirror there and just doing general upkeep because nobody had a mirror in their own home. So this national project has been fantastic for communities. It's something that they're really grateful to have. And it's something that is such a covert tool in encouraging people to have better hygiene and practice, you know, better sanitation, so that they can have pride in themselves as well. And the other important fact, I guess, for me as a parent of 2 preschoolers, is ensuring that the children, because it's the children who are mostly affected by trachoma, have access to these mirrors as well, and have access to water and sanitation themselves, have the capability to do it themselves. And so we've ensured that there are mirrors not only at adult height, but also at child height. We've also delivered towel hooks as well to the program in Western Australia, and that's been absolutely fantastic. Again, it's not something that you think of because it's such a basic tool that we have in our bathrooms, a rack or a hook to hang our towel on, but it's not necessarily the case in these bathrooms. A lot of these towel hooks have actually been placed inside people's own bedrooms because you know, people don't want other people to be sharing towels. We certainly don't want any towel sharing going on, and so we've sort of delivered the towel hook program that way. And in delivering this towel hook program, we've also stumbled on another fundamental missing piece of the puzzle, which is the fact that a lot of people don't actually own towels. So, you know, infectious disease can be controlled when people shower regularly or wash themselves regularly. But if they don't have a towel, then, you know, there is no incentive to go and have a shower, because why would you? And so that sort of just becomes this normal routine. And so part of our program is also looking into delivering 10,000 towels to the Western Australia Safe Bathroom Project as well. And that's currently in the process of happening. Through Rotary, through our Rotarian contacts, we were able to get a really good price on some really great quality towels. Unfortunately, they're being delivered from overseas, and so that project is sort of on hold as well because of COVID-19. This is that fantastic water trailer project that I spoke to earlier that the Rotary Club of Melbourne has been driving, and they're in the process of creating and funding another trailer for up in Catherine. And in my mind, what it really is a portable water park. So it is really great for engaging the kids. It's a fantastic health promotion tool. And the communities love seeing it. The communities love seeing Milpa the goanna, the mascot for the ending trachoma. And, you know, Jim Orchard, who's standing there showing the kids how to use the game, the gamification on it, has been a real driver of the project as well, and is in working on the next one. Obviously, this one was a pilot. The next one is going to be bigger and better. And finally, in this space, we talk about health software and health hardware. So the software is the knowledge of what you need to do to prevent infectious diseases, prevent trachoma, and the hardware is the actual things that you need to do in order to make sure that you can practice what the software has given you. And so again, through partnerships, this is all through partnerships. We partner with organisations who are able to provide the health software. We're not just dumping goods out there, but we're ensuring that the health hardware goes hand in hand with this health software, so that the goods are actually used in the most appropriate way, and you know that towels are washed regularly, they're cleaned, people know about the germ theory and about infection control. So we partnered with Nanapa Health Council. We provided them with things for their health hardware kits. And basically these kits are given out at health clinics, and they're provided when an infectious disease presentation comes along. So whether it's trachoma, whether it's scabies, whether it's rheumatic heart disease, that gets treated in clinic with the appropriate medications. But what was always missing was what happens when that person leaves the clinic, you know, what are they going back to, and do they know what to do to prevent this infectious disease from recurring? So health hardware kits are fabulous for that, and we have so much support for the Ngunnawal Health Council for driving that in the APY lands. We partnered with Pinchapoo through the Rotary Club of Preston for different health promotion teams in the Northern Territory, and we came into a huge donation from Sukin last year, which we were able to pass on to the MPY Women's Council, who run a whole bunch of youth programs and work with women in empowerment programs and environmental health programs as well. So we've been fortunate that we've been able to rotate a lot of the goods from Rotary, the resources from Rotary, into these programs. So 2020, I wrote this prior to COVID-19, but it still stands, and we will continue to understand the needs and aspirations of communities. That underpins our entire project. It's not about what the bureaucracy has said that they need. It's not about what we feel like they need. It's about understanding what they feel like they need and where they want to be. It's been tricky working under the banner of ending trachoma, because ending trachoma is not known as a strengths-based approach, which is the approach that's used, that's encouraged to be used when working in Indigenous communities. Because when you're talking from a disease point of view, you're talking about deficits, and that's not a very empowering way of speaking. So we really mindful of that, and always supportive of the community in their own needs and aspirations. We want to support the enablers of good hygiene practices in community. And we know treatment is really sexy. You know, you can see what antibiotics did to trachoma rates between 2008 and 2012. It dropped the rate of trachoma completely. But what really needs to happen now is proper prevention. And we'll continue our advocacy of strong, sustainable prevention initiatives. And that's what we've done from the first day that we've come on to the trachoma. We've started our trachoma program along with all the other stakeholders like the Fred Hollows Foundation, the different government jurisdictions and Indigenous eye health, and we continue to advocate for prevention initiatives because that's what we strongly feel will eliminate trachoma from Aboriginal communities. Now, these are some of the projects that are actually undergoing implementation in 2020, and they are sort of slowed currently because of COVID-19. And I'll talk to why things in these regions have particularly slowed because of COVID-19. COVID-19, if it ever infiltrated these Aboriginal communities, would be absolutely devastating for these communities. And every single person out there knows that. The Northern Territory government is fully aware, the Western Australian government and the South Australian government is fully aware. And it's because of all the existing comorbidities that would lead to so many more deaths among Aboriginal communities, particularly among Aboriginal elders. And if that were to happen, we'd have rates of 50% of death. I imagine, some of the projections that have been tossed around in terms of how COVID-19 might affect these communities. So, there's been a really clear line drawn of what we can and can't do, and our services and visits to community have completely stopped, and so have many of our stakeholders work in this area stored. But the beautiful thing about our project actually is the parallels that we have with COVID-19. We are all about hygiene and sanitation. And as I mentioned before, those portable water tanks that we delivered to the APY lands are now in hot demand, and we're trying to work with partners to ensure that if we continue supporting the delivery of portable water tanks, that those tanks will have a partner who will be able to look after it, who will take accountability for it, will ensure that it's not just left to rot, that it has a clear repairs and maintenance routine, and that it gets used. But back to this slide, which is the projects that we've committed to. We've committed to an environmental health worker with the largest Aboriginal controlled health organisation in Central Australia, Congress. And it's a project that is going to be jointly funded by the Fred Hollows Foundation. And an environmental health worker is going to be integral to collecting the data on housing. Essentially, it's looking at what needs to be done in community homes, in particular the remote homes, the remote communities that Congress work in. There are 5. And it's to ensure that every home has access to, has continuous access to proper sanitation, infrastructure. So if a drain is blocked or if a shower rose is broken, we can assess how long it actually takes to get repaired, and we can assess what some of those barriers are. And because currently without that data, we're talking to housing, telling them, hey, these things need to happen, and they're sort of coming back to stakeholders saying, no, everything's fine. So without this data, that's so important, we can't actually advocate for change. And we're advocating for change within the existing system. So we're trying to optimise the existing system, which is going to be a lot more cost effective than overhauling the program completely and introducing a new program on safe bathrooms checks, for example, or trying to implement Western Australia's environmental health program into the Northern Territory. It's just not cost effective. So I think it's a really great project to support, and to be able to support an Aboriginal community controlled health organisation is an absolute honour, I think, for Rotary. As I mentioned earlier, we're getting some bath towels to the Western Australia Ending Trachoma program. In Tichikala, one of the other communities, we're installing health hardware on community services, and health hardware simply taps, sink, somewhere for people to wash their hands, clean their faces, and it's going to be across all community services. I think it's 5 or 6, so it might be the aged care centre, the community store, the arts centre, the health service, the childcare centre. And then in Laramba, one of the communities that we've been working in, we've been working with Leslie Martin on installing some infrastructure on their sport and rec hall. Now we've got a wish list for 2020. The Western Australia Ending Trachoma program have requested another 2 trailers for their program. They currently have 2 trailers, one up in the Kimberley and one down south based in Perth. Western Australia is a huge, humongous state. So 2 trailers doesn't really cover the entire region. Each trailer, you can see actually where those trailers currently are or have been. They've been in the Midwest, made a couple of trips to the goldfields down south there, and a few trips up in the Kimberley. And these trailers are really important for the environmental health team to be able to do their work. They're a community engagement tool. They provide a community night where there's a cinema, so they've got a theatre within the trailer that comes out, everybody sits under the stars, watches a movie, but also there's some Trachoma ads which are run pre and post the movie. But all these things are framed around engaging the community, ensuring that they're welcoming community and that their messages are welcome as well. So really important tool. The next trailer that they're looking at will also integrate a washing machine. So a little bit similar to the Orange Sky laundry concept, if any of you might know that, that service the homeless. they go around and they, you know, provide a washing machine for homeless people to wash their things. Well, they're hoping to be able to provide a washing machine which will be big enough to wash these big minky blankets, which, you know, your normal home washing machine might not be able to wash. We'd like to provide more health infrastructure to communities, similar to what was being installed in Titchkala. And there were plans to roll out this program further and advocate for government funding, pending the results, I guess, of the infrastructure from Titchkala. We'd like to be able to provide more amenities for community events, similar to those portable water tanks that I spoke about earlier. So there might be portaloos, ablution facilities, but it's all based on the community and what they want. So, you know, I can't just allocate it half a dozen to a few communities. It's very, very community focused. And something that, you know, Rotarians actually have really jumped on board is creating these hygiene packs for schools and different health promotion programs. So Rotarians have put together these health hardware packs that have included a bath towel, face washer, full-size soap, shampoo, conditioner, toothpaste, toothbrush, and a reusable water bottle to encourage, you know, healthy practices. And they've been really good because they get delivered again through schools, through health promotion programs with that health software. Now, this is a video that I might just end with. Oh, actually, I haven't ended, but this is a video of the Western Australia Ending Trachoma program that I'd just like to show you. It's their Safe Bathrooms program. It'll give you some insight into what actually happens when they go out on community. Okay, I'll just end quickly on how you might be able to help us. Raising awareness, that's one of the main things I actually love about this project, just raising awareness around what is happening to Aboriginal people in Australia. Before I worked as an optometrist out bush, I had no idea what was afflicting some of the communities in, you know, this country of wealth. You know, my family came here as refugees, so this to be in Australia, we were so grateful to be in such a fantastic country where the sky was your limit. But when I hit the outback, it was just, it slapped me, it woke me up to what was going on to Aboriginal people in Australia. So we created a whole series of videos early last, well, 2 years ago actually, interviewing a whole bunch of experts in the field of trachoma, and also Kerry Arabina, who at the time was the chair of the Indigenous Health Equity Unit at the University of Melbourne. And this was, again, in our scoping stage of the project, where we really wanted to understand exactly how Rotary might be able to fit into the picture. Now, you can watch all 70 minutes of it on our website, or my husband put together this highlights video, which is about 5 or 6 minutes long, of some of the most important messages that came out of that. And you'll be able to find that on our website if you want to have a quick look, and also distribute it to everyone that you know, because I think it's a really great video to show people exactly what's going on in our country and what we could be doing about it. Homeland Story is another fantastic documentary that is about an anthropologist, Neville White, and it talks through the plight of an Aboriginal community up in East Arnhem Land, with the support over the years from the Rotary Club of Melbourne. And it also gives really great insight into Aboriginal life, and a documentary that I highly recommend watching. Prior to COVID-19, there were going to be screenings all over Australia. We had rights to screen this documentary and use it as a fundraiser, but I believe there are other things in store by Glenda for this documentary. So keep your eyes out for that. You might like to contribute to something on our wish list. There's Scotty with one of the water trailers, or the trailers from the Western Australia Ending Trachoma program. Stamp collections have been really successful at fundraising for us. There's been some really great numbers raised over the last few years. Camille Rogers in Malvern is currently collecting cutting out stamps and having them weighed and converting them into money for us. She's kindly taken over from Rotarian Carol Farmer. So if that's something tangible that clubs can do, that people can do, that they can ask their local offices, their local health clinics, their local schools to hang on to mail, collect them, bring them to Camille, and she'll be able to sort them out. And the other thing that you can do is subscribe to our mailing list and follow us on Facebook to stay updated. And that's all for me.
Well, thanks, Lien. Fantastic presentation. I knew a lot of what was going on, but it's great to hear it firsthand, and also to hear it from someone so passionate about it, and see the photos at the same time. I don't know if you picked up on Brian's background there, but Brian Griffiths, he's got the Trachoma background. Well done, Brian.
Yeah, thank you.
He's actually out of picture at the moment, but anyway, I have a couple of questions, if that's okay. Okay for a couple?
Yeah, absolutely.
All right, so the first one was from Mark. So Mark, if you just want to unmute.
I've unmuted, because look, Lien, the fantastic presentation. We have chatted. I'm actually an ophthalmologist, but my expertise is not in trachoma. And interesting enough, my work in Indonesia with the Rotary Silver Eye program, you rarely see trachoma. Now, the point is that the public health, this is a public health business, basically. And in your allergen SAFE, S-A-F-E, we really should be getting rid of the S-A and just concentrate on F and E, as you know, because it's the transmission. So my question is, with the transmission, it's person to person and fly as well. Are the Aboriginal communities being forced into isolation like we are? I can't see them on Zoom all the time, but are they in isolation like us? Because it would be interesting to see what it does to the prevalence.
Yeah,
because you
absolutely.
showed that prevalence. Fantastic. Oh, I love the statistics. They're fantastic. But what do you think is going to happen?
It'll be really interesting, actually. I mean, a huge issue out in Aboriginal communities is overcrowding, as you know. So a lot of the homes have way more people in them than there should be. In fact, it's actually one of the challenges to people reporting things going wrong.
And that's the big problem in Asia as well, you know, the overcrowding. That's why it's got into trouble.
Yeah, and if you have young children, you know that they completely don't understand social distancing measures.
Oh, we've seen that in the playgrounds.
And so I can't imagine that the social distancing would be very effective for trachoma, But what might be effective is all this education that is going along with COVID-19 around hygiene. So all the hand washing that's going on, there's actually, COVID-19 has actually been fantastic for our project because, you know, we've been pushing hygiene infrastructure out in community for the last 4 years.
Yeah, we're teaching it now all the time. You should point out actually that when they install pools in the Aboriginal community, so the trachoma rate goes down because the kids are swimming.
Yeah, absolutely. We did look into pools early on in the project. Hugh Taylor suggested that might be an avenue for Rotary to support. A single pool costs $2 million to build, and then maintenance costs every year are in the vicinity of $200,000 to $300,000.
And you pointed out the quality of the water too would be hard to.
Exactly, which is, you know, why there's such high costs involved. But the other barrier to pools actually is that pools need a lifeguard. And if there is anyone that ever drowns under somebody's watch in small communities, that can have huge ramifications. So there are very few people who actually want to be a lifeguard because of the risk involved. So, you know, on the one hand, pools are fantastic because they actually give kids the wash that they need. But on the other hand, there's you know, risks and poor economic outcomes involved. So, yeah, that wasn't a path we were going to go down through this project.
Okay, thanks.
Thanks, Mark. Thanks, Lien. Interesting comments about swimming pools. I don't think of those things often, but all very important. Keith had a question as well, so over to you, Keith.
Yeah, thanks, Grant. The link, possibly, Lien, between the London School of Tropical Medicine and Trachoma, was there a link? Or if not, how did you get involved in the first place in this wonderful project?
So when I came back actually from London, I was about 5 months pregnant, unintentionally actually. And so I had emailed a whole bunch of organisations that I wanted to work for. And I pretty much said, look, I've got 4 months left in me, I'd say. You know, would I be able to work with you guys? And Hugh Taylor at Indigenous Eye Health sort of said, yeah, absolutely. We need somebody to work in our health promotions team at the moment. So I worked with Hugh for a few months before I went on mat leave. And then I was approached a year into mat leave by a number of Rotarians who had heard Hugh speak at their club and had said that they'd wanted to potentially create a project out of it. Could I scope trachoma for them to see whether it would be something that Rotary might get involved in? So in 2016, the World Health Organization was holding their global elimination of trachoma by 2020 meeting outside of Geneva for the first time ever. And it was going to be held in Sydney. And Hugh invited me to go up to Sydney to this meeting to scope the project for Rotary to see if anything was going to be done, or if anything could be done through an organisation like Rotary. And I guess these Rotarians felt that I knew what Rotary might be capable of, and then I had that technical background to be able to make that assessment of whether we could support trachoma elimination. And yeah, it was glaringly obvious to me when I was up in Sydney that there was a huge focus on treatment, on surgery, on antibiotic administration in community, but very, very little being done in terms of prevention. And even though there are a lot of stakeholders who work in Aboriginal health and in trachoma elimination, there was not enough being done in this space. And so I came back to the Rotarians and I said, look, if you'd like a project, I believe there is one. And that's how it came about.
Great, thank you.
Fantastic, thanks for the question, Keith, and thanks, Lien. If anyone else has a question, I can't see any more typed in on the chat, but just pop your hand up.
Mandy.
Mandy's got one.
don't have a question, but more just wanted to make a comment. I just want to say thank you so much, Lien, for sharing the lessons learned and for being unapologetic about the journey so far. Clearly, as well as being really educational, you demonstrated so well why we need to talk more about the trial and error part of our projects. And it's certainly been a really great reminder for me to not so much worry about whether we're on the wrong path or the right path, but just to get on the best path, given the knowledge and experience that you have at the time, and pivot from there. So thank you very much for that timely reminder, and lovely work. It's a great presentation.
Thanks, Mandy. Great to see you.
And Dominic has a question.
Can you hear me?
Yep.
Okay. The question I've got is relating to the kits that I think you mentioned the schools are preparing. It's a bit like the birthing kit type arrangement, and I'm just wondering, how do we get some further information on that side of things? Because that seems like a very feasible thing to implement in any Rotary Club anywhere in Australia.
Yeah, absolutely. So Sally Dell from District 9810 has kindly stepped up to help coordinate that program. It's currently, you know, not something that we're pushing hard at the moment, considering these restrictions, because we don't know logistically how we would be able to get those packs up into the areas that require them. At the same time, you know, Sally, just before the lockdown came into place in the Northern Territory, Sally and her husband Peter had taken a trip up to Alice Springs. It was meant to be for a week, but it ended up being cut short to 3 days, I think, because of the lockdown. And that, you know, she'd taken a whole bunch of stuff up from donations in kind. She'd taken all these hygiene packs up, and it was so timely. They were so gratefully received by a whole bunch of organisations up there, because we were working in hygiene and sanitation, and it's so relevant for those communities right now. You know, they don't care about trachoma. Trachoma doesn't affect them in their day-to-day life. It's a bit of conjunctivitis on their kid. And like I mentioned, it takes 250 to 300 infections before they'll see some real change to their life. So in terms of prioritising and trying to get them to care about trachoma, it's so hard. But having COVID-19, where there's this acute need now for hygiene and sanitation out in community, it's actually been really great for the project and for Rotary now to get on board and create these little magic packs and these little projects that we can help deliver out there.
Thank you for that. Thank you for that.
I can put you in touch with Sally Dell if you email me. So you can find out my email address on our website, intrachoma2020.org.au.
All right, fantastic. Thanks again, Lien, for your presentation tonight and answering all those questions. Brilliant. I think Mandy summed it up best. So really appreciate your being here. And we have recorded this, so we'll get it posted up either on our Facebook page, or at least a link to our Vimeo or YouTube pages. So if everyone knows, either give a round of applause like this, or you can use your reactions button like that. There you go. So a few people know how to do that. Excellent. Well done. So thanks everyone for joining us again tonight. I just wanted to say just before we go that we've done really well as a district. Most clubs, and I'm only aware of maybe 2 that aren't using Zoom yet to have their meetings. So we're staying connected, which is brilliant. There's a lot of projects still going on, which is also good, but we can share more ideas. So keep looking at the Staying Connected page on the district website and put your ideas up there as well. Because the more we share, the more we're going to have things to do as Rotarians in these challenging times. The final thing is our fundraising, and we're just starting to ask questions about that. So if you've got ideas for fundraising, again, during these times of isolation, then there are things we can be doing to fundraise. So pop your ideas up there as well and share. So thanks everyone. Good to see you all. Stay safe, stay healthy, and see you next time. See you later. Bye.
Bye. Thanks, everyone.
Thanks, Lien.